Birth defects. What is an amniocentesis? The process of withdrawing a sample of the amniotic fluid surrounding the unborn baby. Chorionic villi sampling, a prenatal test that uses a sample of the tissue from the membrane that encases the fetus to check for specific birth defects. Samples of the tissue are cut or suctioned off and analyzed. Cerebral palsy. Definition: general term for a variety of problems of the motor system. Symptoms can include lack of coordination, stiffness, difficulty with speech and paralysis. Causes vary but include damage to the brain before, during or shortly after birth. Detections: motor skills are typically slow to develop during first year of life. Treatments: damage to brain is irreversible. Physical and speech therapy, surgery and medication can often lessen effects. Cleft lip and cleft palate. Definition: a gap in the upper lip or palate, roof of the mouth, that causes problems with eating, swallowing, speech and appearance. Causes may be caused by heredity, environmental factors or both. Detections: conditions are apparent at birth, often detectable by ultrasound before birth. Treatments: surgery corrects the gap and helps eliminate the problems associated with it. Cleft lip. Cystic fibrosis. Definition: affects respiratory and digestive systems. Many with CF die before adulthood, although treatment now allows those with CF to live longer. Causes: caused by inheriting defective recessive gene from both parents. Most commonly affects Caucasians. Detections: blood tests can identify carriers of the gene. Sweat test can diagnose an affected child. Treatments: no cure. Special diets, lung exercises, therapies and medication can treat symptoms. Cystic fibrosis. Down syndrome. Definition: a group of problems that may include mental retardation, heart, blood and digestive system difficulties and poor muscle tone. Cause: the presence of an extra chromosome 21. Detections: can be detected in a fetus by amniocentesis or chorionic villi sampling, or after birth with a blood test. Treatment: no cure. Treatments include therapies, special educational assistance, and in some cases, corrective surgery. Muscular dystrophy. Definition: there are many different types, all involve a progressive weakness and shrinking of the muscles. Most common form begins between ages 2 to 6. Cause: most types are hereditary. Most common form is transmitted by female carriers of the gene but affects only males. Detections: recognizable once symptoms appear. Genetic counseling can ID carriers. Treatment: no cure. Physical therapy can minimize the disabilities. Muscular dystrophy. PKU, phenylketonuria. Definition: condition in which the body is unable to process and use a specific protein present in nearly all foods. Brain damage and mental retardation can result. Causes: defective recessive genes inherited from both parents. Detections: newborns are tested for PKU, as required by law in all states. Treatments: no cure. If diagnosed early, a special diet can reduce or prevent brain damage. Diet for PKU. Sickle cell anemia. Definition: malformed red blood cells interfere with the supply of oxygen to all parts of the body. Symptoms include tiredness, lack of appetite and pain. Can lead to early death. Causes: defective recessive gene inherited from both parents. Most common in African Americans. Detections: genetic counseling can ID parents who carry the gene. Amniocentesis or chorionic villi sampling can ID in a fetus. Blood tests detected after birth. Treatments: no cure. Medications can help treat symptoms. Sickle cell anemia. spina bifida and hydrocephalus. Causes seems to be a combo of heredity and environmental factors. Taking a folic acid supplement during pregnancy may reduce incidence. Detections: spina bifida is apparent at birth. Hydrocephalus is indicated by overly rapid growth of the head. Tests of mom's blood, amniocentesis, and ultrasound can reveal suspected cases in fetus. Treatment: corrective surgery, physical therapy and special schooling can minimize disabilities caused by spina bifida. Hydrocephalus can be helped by surgically implanting a shunt that relieves fluid buildup. Definition: in spina bifida, an incompletely formed spinal cord may lead to stiff joints, partial paralysis, and problems with the kidneys and urinary tract. 7/100 children with spina bifida also have hydrocephalus, in which an excess of fluid surrounds the brain.